dangerous is it? Should they do it?
We think so, yes, absolutely, but it has to be in a safe way.
Yeah.
And that, in our opinion, obviously our protocol is very, very safe. As Graeme said before, you have to make sure that the mercury is drilled out with a lot of water, and you have extra suction, that the patient is breathing in oxygen, and also have the vitamin C infusion at the same time with the glutathione, so that you don't absorb any of the mercury.
Now, before the programme, you were mentioning the fact that some people, when they go to have their fillings replaced, some less reputable dentists, shall we say, don't actually take the mercury out. So how does that work?
Well, this is just from our own experience, because we see a lot of people who have come to us with, having said, we've had all our amalgam fillings, all the mercury fillings removed.
Yeah.
And we find it, we've actually got statistics of it, that 50% of the people who come to us and said, I've had all my mercury amalgam taken out, there is still mercury amalgam left in their mouths.
Good Lord. So job not done, basically. So in terms of the final question there, Western A price, raw milk and butter in the diets of these, dare I say, obscure cultures, perfect teeth. So how much is diet a part of the entire situation?
That's Western Price, Western Price was a dentist, and it depends, we can keep you here for another 3 days on this topic alone. He was a dentist, and he was the one who actually brought forth the toxicity of root-filled teeth.
Right.
And he went round the world collecting information on diets, but diet's critical. But Lillian's, I want to talk about diet.
Right, so diet and health in terms of the dental profession, how does that play? I mean, one example that immediately springs to mind in the book is you mentioned selenium and how valuable that is in terms of health. So how does selenium work in terms of what we've been talking about today?
Well, the problem is that our soil is completely, or very often very selenium deficient, or you just don't get the levels of selenium that you need. And again, selenium is very good for binding mercury as well. And but if you're talking about the diet per se, what really you want to achieve by a good diet is, of course, an optimum pH in the body.
Right.
And pH, hundreds of years ago, was the only way you could actually adjust things was through whatever you ate.
Right.
And people found out very quickly that if you ate a wholesome diet, you know, you ate grains and you had maybe meat and a lot of vegetables, then obviously your pH in the body would normalize, and you would get rid of a lot of symptoms that you get otherwise.
Yeah.
Like, well, any acidic problem in your body, basically. And
I mean, certainly I'm coming back to the selenium, obsessed by certain subjects. Selenium, I am told 1 Brazil nut a day is enough selenium for your body to start getting on the right track. I mean, is that accurate?
Well, that is, if it comes from a good source, then yes, a good Brazil nut, a reasonable size, will give you 200 micrograms of selenium, and that's certainly a good source. Whether that's enough in this modern day and age, we don't know.
Well, I always eat the whole packet, so I mean, that solves that
that's
one.
That's the way to do it. See, selenium and mercury have a very good affinity, and if you're deficient in selenium, then mercury will lodge onto the places where selenium is, say, especially in things like the thyroid.
Yeah.
Therefore, you use selenium in fact to displace mercury from the body.
Right, I'm with you. Okay, so moving back to what we were discussing before the break, we were talking about your movement around the world, spreading the message, and what sort of reaction are you getting from foreign climes?
Well, by and large, we sort of preach to the converted. These are the people who invite us over. But the message is getting out there. There are whole groups of doctors and dentists who are getting together, who are questioning this. I mean, we had one famous one, a doctor now sadly deceased called Thomas Stone, who actually came to one of our meetings and said, I know you're dentists, I know you dentists are killing my patients, I just want to find out how you're doing it. So the message is spreading, it's going out there.
Yeah. And this sort of traffic works both ways, because you're actually getting patients coming from all over the world to see you. So,
well, they call us the end station, really, because most of our patients who come to us have been seriously ill, and conventional medicine has provided no answer, and most of the time neither has alternatives. And they come to us, really, they're stuck, they've nowhere else to go, so they hear about us and come to us. And we take the toxins out of their mouths and do it this particular protocol. And 80% of them, no matter what disease they come in with, do in fact suffer a major resolution of these symptoms.
And certainly there's a lot of examples in your book of case studies where people who have given up hope come to you and everything is sorted. I mean, I gather there was a case of, I think it was a lady, who had work done on her tooth, and actually took the sight in one eye away, and then you guys intervened. So what happened next?
Yeah, she came from South Africa, didn't she? She was an accountant, and she was going blind, and she'd had to give up work because she couldn't see. And so she came. This was in the very early days, wasn't it? So it was a one root filled tooth. Again, a root filled tooth is only just centimetres from the eye. Took that root out, and we found the dentist had actually stuck a silver point through the apex, through the root of the tooth, stuck it into the bone. Tooth came out, and within a matter of days, her eyesight returned.
Wow. Simple as that.
Yeah, that was in the early days. That was literally an eye-opener for us too.
I should say. And Graeme, I mean, we need to mention your work with the United Nations Environmental Programme, UNEP. And this, I gather, is all based around the possibility of a worldwide treaty to ban mercury. So, does that include dental amalgam? Are they happy it includes dental amalgam?
Well, it didn't in the beginning. This is how I got involved. And I was on holiday and I got a phone call and said there's a meeting in Sweden. It's about mercury, and they don't understand yet that 50% of amalgam is pure mercury. So I went over and managed to inform them politely but firmly that they had to address this, and now amalgam is firmly on the agenda. And there is a worldwide treaty being negotiated to come into force in 2013, which will take mercury, hopefully, from the world, which will include amalgam. But obviously it won't happen overnight, there'll be a lead-in time. But it looks like we're coming to the end of the amalgam era, finally.
And what's been the reaction in the UK to this?
The UK just follows the EU, and that's the UK government. The UK dentists, like the British Dental Association, they're just following the American Dental Association. And the American Dental Association was actually founded to promote the use of mercury. Really? And to this day, they say that mercury should be used. We don't see a problem with it. You know, well, they wouldn't, because they used to hold the patents on it for a start. So,
right. So the money supply is coming with it, and
follow the money,
as usual, with lots and lots of stuff. I mean, this does sort of bring into